Good evening. My name is Tajiria, and I attend the University of Alabama, where I am obtaining my Master's of Science in Population Health Sciences. My presentation it looks at farmers markets as practical tools to address rural nutrition disparities. So, for my background, food insecurity is a persistent population health concern, specifically in rural populations. This is due to geographic location, limited transportation options, and also reduced availability of full service grocery stores and farmers markets. So, just to give some numbers and stats, 23.5 million Americans live in a food desert, 15% of people in rural areas are hungry, 4.2% of Americans don't have a vehicle and live more than a half a mile from a grocery store. And lastly, food deserts are more common in rural states like Wyoming and Nevada. So, my research question is: what strategies improve the coordination and effectiveness of farmers markets as nutrition interventions to reduce food insecurity in rural communities? So, why did I choose farmers markets? I chose them because they offer fresh, nutritious food access that's also free, local economic support, community engagement, and I also want to add it offers a social aspect as well. So, just to give more numbers and stats, these percentages shown are of households that do not live within 1 mile of a grocery store and have no working vehicle. I thought this was interesting because I reside in Tuscaloosa, so it was interesting to see that this is a problem that's persistent and that's occurring in where I stay at as well. So my methods for this project, I conducted a qualitative literature synthesis, or also called a review of literature, that looked at cross-sectional and mixed method approaches. And I also have planned some community surveys that are going to be pre-post surveys that are measure access, dietary behavior, and usability and barriers. So my key findings and results from this project is community-based efforts using existing infrastructure are key to improving healthy food access and diet quality in rural, high obesity, low income areas. Additionally, farmers markets found near existing grocery stores leave many low income or rural areas underserved. This is due to a lot of grocery stores being placed in more urban areas than rural areas, that sometimes leave individuals who live in rural areas to have to commute 30 minutes to an hour, sometimes even more, just to get to a grocery store and also a farmer's market. Lastly, farmers markets drives economic, social, and environmental benefits. So some system gaps are also system limiters are markets not integrated with nutrition programs, market placement suboptimal, transportation barriers, and also limited evaluation data. So, future directions for this project, as mentioned, I plan to conduct the community surveys. Also, identify and evaluate existing interventions to determine how they can be improved and or expanded. And lastly, organize nutrition workshops to provide hands-on demonstrations for preparing healthy meals. These are my resources. Thank you.